Hi again. Let's do muscles of mastication. So this is, there's more detail in this unit than, say, for example, the muscles of facial expression. We just needed to recognize them, spell them correctly, and tell me a little bit about what they do based primarily upon their name. Muscles of mastication, there's more detail that we're going to go into. So general comments, there are 4 pairs of muscles, of course bilaterally symmetrical, and all of them work on the TMJ. In other words, they move the mandible at the TMJ. So all of these muscles, as I mentioned previously, they all insert on the mandible. So you know the insertion already of all of these muscles somewhere on the mandible. And they're all pretty close to, they're all working on the TMJ. So the movements that you need to know that these muscles produce are elevation and depression is minimal. So none of these muscles really pull the body of the mandible inferiorly. When we're talking about depression, which we'll go over in detail, we're talking about the condyle only. The condyle is depressed, is pulled inferiorly out of the mandibular fossa in the temporal bone. So it's coming down just a couple of millimeters to get it out of that fossa so that it can move. That's the only depression we're talking about here with these muscles of mastication. None of these muscles are going to do a powerful jaw drop. It's not those muscles. That type of movement is going to be from muscles inferior to the mandible pulling it downward. These muscles of mastication are all about elevating the mandible under force to grind the food. Okay. You're going to need to learn the origins, insertions, and actions. And these were the actions above again. Primarily elevation, protrusion, retraction, and lateral deviation. These are all innervated by V3, which is the mandibular branch of the trigeminal nerve. So you know the nerve for all of these muscles of mastication, just like you know the nerve for all of the muscles of facial expression. Okay, and then here's that comment again about depression. Okay, so that's where we're going. So we'll start out with the masseter. It is the most powerful elevator of the mandible. Its origin is on the zygomatic arch. So you know where the zygomatic arch is, you know where the zygoma is, that's where it's originating, and it is inserting on the angle and the ramus of the mandible. And its action is only elevation, as indicated by the yellow arrow. The figure on the right is interesting because it shows the muscle that's been cut off of the angle and the ramus. So all of these little muscle bundles that are cut are muscle bundles of the masseter. So this is where it has inserted all along the angle and the ramus. And they all run up and attach to the zygomatic arch and pull the mandible superiorly. So that's the masseter. Okay. That one you probably did in A&P 1. Next one is the temporalis. So again, it inserts on the mandible here on the coronoid process. So all of these red muscle fibers are running back and attaching there. Okay? And so the origin is up here on the temporal fossa. Sort of a shallow region on the skull, and that's where the temporalis muscle originates. The action now. You get two things, depending on which muscle fibers are contracting. So if we're looking at elevation, go to color, a little more contrast. Elevation, to get this sort of movement, you're going to be contracting these fibers that are more or less in a vertical position. And when they contract, they're going to be lifting the coronoid process upward. And it's pivoting back here in the TMJ. So, you know, it's going to, like a little lever, it's going to go up and down with depression or elevation. So it's those anterior fibers, the ones that are more vertical, which will cause elevation. If we are contracting these fibers that are running more or less horizontally, when those muscles contract, they're going to be pulling the coronoid process posteriorly in that direction. So that's going to produce retraction of the mandible, because the mandible can move forward and backward. So the temporalis, those posterior horizontal fibers, are going to be retracting the mandible. So the two actions are elevation and retraction, depending upon which muscle fiber groups of the temporalis are active. Next slide. Review. So there's, again, the two pictures of the temporalis and the masseter. And along with review, all of these other muscles of facial expression. So I would go back, take off, blank out the labels, and make sure that you can identify those. Okay? You may want to enlarge that on your computer. But you should know everything in this slide, both of these pictures. Some of this we haven't gotten to yet, like the pterygoid muscles, we will do next. Okay. Next slide. Pterygoids. We have a medial pterygoid and a lateral pterygoid. Medial pterygoid's easier, so let's start with that. So they're deep. The medial pterygoid origin is in the pterygoid fossa, the medial surface of the lateral plate. So that's what's shown over on the right. You have to kind of get yourself oriented, so you're looking from the back up underneath the mandible. Here are the nasal cavities. So you're looking at the inside of the mandible. Here's the mylohyoid line. There are little genial tubercles. Okay. There is your incisive foramen. So you're oriented. And the medial pterygoid inserts on the angle of the mandible only, not the ramus, only the angle. And the origin is, again, with the medial surface of the lateral plate. So the pterygoid fossa is more or less over in this area. And this is the medial pterygoid. On a more lateral view on the left, this is the medial pterygoid. We're not going to worry about the two different heads of it. We're just going to treat it all as the medial pterygoid. Now, don't confuse that with the masseter. So you have to appreciate, that this is a deep view on the left. You are deep within the infratemporal fossa. Okay? There's your buccinator muscle. And we'll come back to these lateral pterygoids in just a minute. So that's the medial pterygoid. Elevation is, the action is elevation, but it's much weaker than the masseter. Okay? So we have three muscles so far that elevate the mandible. We have the masseter, we have the vertical fibers of the temporalis, and we have the medial pterygoid, our elevators. We had a retractor set, which were the posterior fibers of the temporalis. Okay? And then we go to the lateral pterygoids, which, backing up a slide, are these. So we'll be spending a fair amount of time on the lateral pterygoids. So, they're important to understand for action on the TMJ. There are two heads of origination, a superior and an inferior head. You remember the biceps brachii had two heads of origination, and the quadriceps femoris had four heads. Well, the lateral pterygoids have two heads of origination, a superior head and an inferior head. And all of this, again, is entirely within the infratemporal fossa. And you know where that is, because we did that pretty much on day one. Okay, so here we go. And we'll show pictures of this. You can bounce back and forth to pictures as we go through this. Origin of the superior head is the inferior surface, greater wing of the sphenoid, which is essentially the roof of the infratemporal fossa. And during Zoom time, we can look at a skull and see that if we want to. The inferior head, the origin is on the lateral surface of the lateral pterygoid plate. The inferior head. So here are your pterygoid plates. And do you remember what muscle attached to the medial surface of the lateral pterygoid plate? Yeah, it was the medial pterygoid. The insertion of both of these, all of these lateral pterygoids, run posteriorly and insert in the pterygoid fovea or the pterygoid fossa of the mandible. And you should remember where that is. It's just inferior, very close on the anterior surface of the condyle. So there's a note here for you to read. This is the unit, this is the section in your book that's important for you to read, and read it more than once because it takes a while for the language to click. But the authors of your textbook did a good job in writing it. So this is the text. You need to pay attention to reading that and understanding what the description that they're picturing, are trying to give you a picture of. And that will help you with your essay that you're going to have to write describing the action of these muscles at the TMJ. Lateral pterygoids are very important. Okay, let's go on, I think, to pictures. Okay, so the lateral pterygoids, here is the inferior head and the superior head as indicated by the labels. And this is the origin of the superior head. It goes underneath. The infratemporal crest is right about here, and the superior head is going underneath that, and that's the roof of the infratemporal fossa. Okay? And the inferior head is attaching to the lateral surface of the lateral pterygoid plate, which is hidden. Okay? So superior head and inferior head of the lateral pterygoid. Here is the TMJ exposed. Which we'll come to later. So you can see the bony portion of the condyle. And here is the pterygoid fossa or the pterygoid fovea in red. Also attaching to part of this TMJ. You kind of see it going back and attaching to the capsule, but we haven't talked about that structure yet. So what's going to be the action of these muscles? Just looking at the picture and knowing that the mandible moves and muscles get shorter. Draw an arrow showing the direction of movement. It's going to be pulling straight from the insertion toward the origin. And that is going to produce what kind of movement? You would describe that movement of the mandible as protrusion, jutting the lower jaw forward. Okay, again, you should be able to recognize all of this. We haven't talked yet about the pharyngeal constrictors, but we will. So I would, when we're done with this module, you should be able to identify all of that. Okay? Lateral pterygoid muscle actions. So here we go. The superior head is just straight protrusion, as I drew it in the previous slide. Condyle goes anterior, jaw juts forward. Inferior head protrusion, yes, there are fibers that run in that direction, so that will produce protrusion. And here is the little bit of depression, very slight. Again, it's only pulling this condyle down with these inferiorly directed fibers running in this direction. You'll get a little bit of a downward pull of that condyle, and that's just enough to pull the condyle out of this mandibular fossa. It pulls it down and allows it to go forward. So that's the idea when we're talking about slight depression of the TMJ. It's that little bit. Again, we're not talking about jaw drop. Okay? So let's talk about unilateral and bilateral contraction of the lateral pterygoids. So if you have unilateral contraction, that's one side of the head and of the skull. Both the superior and the inferior head. So that's what we mean by both heads here. We're talking about the superior and the inferior heads. So as shown on the skull, we're looking at the left side of the head, both heads of the lateral pterygoid. So left side of the skull, left side of the face, and the two heads of the lateral pterygoid. So if just one TMJ is pulled forward and the other TMJ stays stationary, think about what's going to happen with the mandible. One side stays stationary, the other side moves forward. What's going to be the action on the mandible? So if your right TMJ is stationary and your left TMJ, the condyle, moves anteriorly, what's the jaw going to do? It's going to pivot on the stationary joint and it's going to deviate in that direction. So if the right side is stationary, the left side pulls forward, the jaw is going to shift to the right. And we can go over this and demonstrate it in Zoom time during class. It's mainly just looking at the mandible, thinking about what's happening on one side or the other alone contracts. If both sides contract, both sides of the face contract bilaterally, both sides, the jaw juts straight forward. But if only one side is pulling on a condyle, so only one condyle is moving forward, the mandible moves to the opposite side. So this, I want you to make sure that this clicks with you and that it makes sense and that you can talk the talk and write it out in an essay that makes sense to your classmates, it makes sense to you, and it makes sense to me. Okay? And that was it for the muscles of mastication. So maybe some review suggestions. Review muscles, plural, muscles of mastication. Read the textbook. Read this section in text carefully. I don't think you need to necessarily read the description of each of those muscles of facial expression carefully. If you can identify them and tell me a little bit about their action, I think you're okay. But on this part, for these muscles of mastication, you really do need to read the book. And this is going to include the TMJ. And I think our TMJ, for some reason, I believe I put it at the end. Yeah, probably would go well here, but we'll come back to it. So you should also read about action of TMJ. So these are the movements. And this is primarily the lateral pterygoids. Lateral pterygoid muscles, plural. So I've introduced those to you. I've talked about the origins and insertions and actions, and now it's up to you to spend time reading about this, writing about it, wrapping your head around it, and visualizing the action of this. And in our Zoom class time, I have a skull and a mandible, and we can talk more about that. But it will click a lot better when we do it in Zoom if you spend some time studying it ahead of time. Okay, so that's it for muscles of mastication. And I think the next lecture I'm going to do is on suprahyoid muscles. And we'll go from there. supra and infra hyoid muscles. So, okay. See you soon.